My name is Brittany Bisking. I am the clinical nurse educator for the Surgical Progressive Care Unit here at Barnes-Jewish Hospital. I'm going to talk to you about how to take care of your tracheostomy. So whenever you have a tracheostomy, it is an airway that goes right into your trachea to help you breathe. So we need to make sure we keep it clean and dry. So some key points that you want to know about your tracheostomy is it has an outer cannula, an inner cannula, and then trach ties that hold it in place. You might struggle with your tracheostomy is you feel the need to cough frequently. You feel like there is something down in your throat, into your trachea, and that you need to get something out. Sometimes you might be coughing up mucus, sometimes it might be that irritability of that tube down your trachea. So it's normal to cough whenever you have a tracheostomy. We want you to cough to try to get up some of that mucus that might be down there. You might also just be coughing because of the irritability of the tube that is in your trachea. Another struggle is whenever you have to suction the mucus out because maybe you're not able to get the mucus out yourself, we will put a cannula down your trachea to help suction that mucus out. That can be very irritating sometimes. It can make you feel, that you need to cough. It can make you feel short of breath. A lot of anxiety comes with that, but rest assured, you're in good hands. A tip whenever you're taking care of your tracheostomy is to have a caregiver or a friend or family there with you so that way you don't feel like you're alone. We will help educate you and your family members to help you in any situation. A humidifier is something that moistens the air. So normally your upper airway moistens the air when it goes into your lungs. So we have to artificially do that. So you will learn how to maintain the inner cannula, how to clean around your tracheostomy, how to suction your tracheostomy, and how to change the trach ties. So the inner cannula helps keep your trach tube clean, maintain it open, and remove any mucus buildup so you can breathe easier. The inner cannula may be disposable or it may be metal. So you need to make sure you understand which type of trach you have. So this patient has a disposable inner cannula. So whenever it gets buildup, you can simply remove it, throw it away, and grab a new one. Whenever you're inserting it, you can go at an angle or go completely back, but you want to make sure it clips in so that way it is secure. We recommend that you change your inner cannula twice a day, once in the morning, once at night, and any time in between the day that is needed. If you have a metal tracheostomy tube, you're going to want to clean that inner cannula once in the morning, once in the evening, and then as needed throughout the day. So I'm going to teach you how to maintain the skin around your tracheostomy. So first you're going to want to make sure you remove the dirty gauze that's underneath your tracheostomy. Then you can either take either a sponge or a Q-tip and spray it with some wound cleanser. Afterwards you're going to take that and clean underneath and around the site. After you clean around the site, it is going to be wet and you want to make sure you keep it dry. So you can either use gauze or a washcloth to dry around the area. So after your tracheostomy site is clean and dry, you're going to want to replace that sponge and change out the trach ties. This will best be done with a second pair of hands. So remember, whenever you are changing out the gauze or the trach ties, that you hold the tracheostomy in place. So now we're going to talk about how to suction your tracheostomy. First, you're going to get your suction canister. This might be on a table or onto your side of the chair. Wash your hands and then apply clean gloves. Once you are ready to actually suction, you are going to keep your finger off of the suction part and insert the catheter until you need to cough or it stops going. Then apply suction by placing your finger over the port. Slowly pull the catheter out. You may need to repeat this multiple times. After suctioning, you might want to wait 30 seconds in order to catch your breath before you go back down to suction again. Your doctor may have you use some saline bullets to help break up the mucus. Apply a couple drops of saline into the tracheostomy. Wait a moment before suctioning it out. If you're having difficulty breathing, try suctioning your trach. If you're still having difficulty, change out your inner cannula. If the difficulty persists, use the saline bullet and then suction. If you still have difficulty breathing after completing all these steps, then you should call 911.